Hi. So the next thing I want to talk to you about is now the supervision workbook. So I'm going to share that, get that up for us on the, let me see if I can find it. Oh, there it is. Yeah. So this is what I am talking about. The thing with the hut on the front. So just for a bit of personal sharing there, that's on Lindisfarne, the island of Lindisfarne, or sometimes known as Holy Island. It's near where I have a house in Scotland. They've got some upside down boats, and it's kind of quite romantic, isn't it? It's a nice scene. Anyway, so that's again something that I hope makes you feel all nice and comfortable. But what we actually invite you on this reflective supervision workbook is for you to substitute that with your own picture that has a meaning for you. So you can see there I've written a bit of narrative under it, just as an example. And you know what we'd invite you to do there is to insert your own sort of picture and talk about yourself in a reflective manner. Now, this workbook is a combination of a number of things, okay? We started this a couple of years ago with the idea of it sort of almost being like a journal after the session with a few focus questions. Now it's developed a bit, and that replaced in the past what we used to have was a sort of classic essay of about 2,500 words, you know, on an area of supervision. But what we decided to try was something a bit different, to kind of a bit dry essay formula, and go for something a little bit more alive, a little bit more reflective week on week, a bit more personal, and kind of getting a sense of how this makes sense to you. And also the thing about essays these days, you can get ChatGPT to do your essay, can't you? And we don't want that, you know, we want to hear from you. So anyway, so that's, and it talks about guidance. The other thing is thinking about supervisor as sort of self-supervisor. Yeah, I guess one of the things we all naturally do before we go for external supervision, as it were, is we actually think about something that's happened and reflect on it. And it might be that we make sense of that after we've experience the incident ourselves and don't need to take it any further. Or sometimes you find as you're writing up, say, a note on a patient or a client, a few things, a penny drops, you know, so that whole process of just writing something down helps you to put things together and integrate things. And then sometimes it also brings to light, oh, I really need to talk about this with someone. So then you may bring in another person informally, like a colleague, have a discussion, and then you might think, well, I do actually need some supervision on this. I'm going to take it to supervision, and so you take it further. So that could be the way my mind works sometimes, is it can be running around in my mind, and then I sort of think, right, I'm just going to get this down on paper and make some sense. So in the workbook here, we talk about then just writing your reflections subsequent to the session. And the other thing then, because we've now got the CPCAB accreditation, is that they are criteria based. And what that means is that they want everybody, it's our course, but it's done the CPCAB way. So the assessments are all ours, but the criteria bit of element of the assignment is from CPCAB. And that is reflected through our learning outcomes of the programme. So there are like 7 broad learning outcomes that are broken down further, which we'll share with you later. But within those, what we've done is we've translated those across to the workbook. So within the workbook, you can see here, on here, that you've got the yellow bits, which are just broad questions that you can respond to. And then the white questions, where they're numbered, they relate to the actual criteria of the program. And so those we want you to respond to the white criteria. So those white criteria questions are your criteria, and it's important that you respond to that specifically. And we've put them into the order of the sessions, but as you can see from the different numbers, they relate to different criteria. So this will save you signposting things later because it's all down in the workbook. So each time you see a white bit, you know that's a criteria and you need to respond to it in a sensible way. So the first one, reflect on the need for and different forms of personal and professional support. So you can think of, well, look, supervision is one form of support, perhaps counselling is another. Perhaps mindfulness might be another form of support. So, you know, there are different forms, and you might just talk about, for you, what, you know, how would you make that distinction about when you need supervision versus when you perhaps need counselling versus when you might opt for another form of support, might be mindfulness or yoga or going for a run or whatever works for you. All right, so if we look at then 4.2, and this will follow the session on the first day, because we do spend some time distinguishing clinical supervision, so CS, that means clinical supervision, from other forms of intervention in health settings. Again, this is something that can be quite confusing, that management will often see supervision as one thing, staff will see it as another. So it's important that you as trainee supervisor are able to distinguish clinical supervision and also distinguish it from other forms of intervention. So training, mentoring, disciplinary processes, and so on. So again, getting that down, you'll be answering a criteria. That will be a box ticked. And we need to tick those boxes for the CPCAB. So don't get too wound up, but just answer it clearly. And if you're unclear, or it's, you know, like sometimes you think you're clear in the class, don't you? And then you're asked a question, you think, Christ, what does that mean? So if you're not clear, you know, just come back and talk to tutors, talk to peers until you get clear. So no problem with that. But here's another one now. Reflect at the beginning of the programme on your strengths and limits of your proficiency in relation to supervision, training and context. So you might say, well, look, I've experienced quite a lot of supervision. I haven't done very much of it, but, you know, so far people tell me I'm a good listener. But what I'd like to know more of are specific supervision models, which, you know, is a bit of a limit at the moment. I don't know many models. You know, I've had some training in supervision, but it's only been in maybe CBT supervision or a particular kind of supervision, and I'd like some training in some different approaches. So that's sort of something to think. Another one is, how will you use the supervision group to help you grow and develop? So again, you know, what are your thoughts on that? You might have thought, oh, I didn't even think of that. I didn't even think of how I'm going to use. So start thinking about it. You know, that's fine that you didn't think about it, but now you can, sort of thing. And you'll meet your supervision group and you'll begin to understand, just as in individual supervision, you know, when you actually get with a supervisor, you know, you can see that some supervisors are more sort of talented in some areas than others, and you kind of mold yourself to that, don't you? And ditto in groups, you know, some groups operate in one way, some groups operate in another. And as you grow and mature, sometimes you can ask for those needs to get met in the groups or in one-to-one, or sometimes you may go elsewhere to get those needs met. It sort of depends on a range of issues, doesn't it? So that's kind of the way into the thing, and I hope that it will bring up some interesting answers for you. You know, just in doing those questions will help you to reflect more deeply on the program, and just to enjoy that process. Really, don't go on for ages. You know, try and keep it fairly brief, but thoughtful. So if I can just lead you to the back now of the supervision workbook. So as you can see there, Amelia's colour coding there. So we're all sort of yellow and white until we get to the back of the book where, that's right, where we now got a space for supervision notes. Now, notes should be traditionally brief. Yeah, we want to keep those brief as we possibly can. So you got your supervision placement record here. So we've given you a little place to put in, you know, you've got so-and-so, you might want to initial the person there, or anonymize them in some way, or just have an initial, because this book is yours and is confidential in that sense. So you keep your dates and locations of sessions, keep an idea of the key themes that came up in the session. It might be professional development, career development, peers in the workplace, relationship with manager, whatever it is, sort of thing. Your own personal reflection. So how did you feel in the session? I might have identified quite strongly with it, or I struggled to identify. So just give a little bit of a sense of where you are in it. So it's enough as like an aid memoir for you. So when you're looking back, it's an aid memoir. And then there might be something that you carry forward to the next session. So is there anything that's, you know, sort of in your mind for the next session? So you've got really sort of tidy way of keeping a note there. If you keep any other, you can always keep a personal journal, which could contain more extensive notes for how the session has affected you, rather than it being notes on the supervision as such, okay? And that can be entirely private to you, then it can't be subpoenaed. So you may choose to do that as well. Now, what the criteria go on, because there's about 54 criteria. Okay, so here they are again, obviously different criteria, but all part of the seven main criteria. And so this is how the criteria relates to your supervision practice then. So here we sort of invite you to sort of think about, for example, share and signpost briefly your understanding and ability to work within an ethical framework in accordance with legal requirements, policy and procedure. So you may say, yeah, you know, which framework are you working with? And you might also, if it's multidisciplinary supervision, you know, for example, yours might be BACP and your supervisees might be NMC, which is the nursing framework. So you've got your different kinds of frameworks going on there, and it will be useful for you to, if you're the BACP, is to have a copy of the NMC ethical framework, so you can have a little peruse through that. I would say all ethical codes do have pretty common, and we'll look at that in the ethics session. You know, there's about 8 common themes in all professional codes, really. So that it's not difficult to get hold of that when you're working with someone. If you think if your ethical framework says what the person's doing it borders on the unethical, then there's chances are that their professional framework will be saying the same thing. So an opportunity to check it out. But anyway, it's useful to be familiar with that, and you can make a note of that. And then if I can look at another one, for example, share and reflect on how you facilitated your supervisee to address their skills development. So you may have had a conversation with your supervisee about their continuing professional development, about their training. You may have explored with them how they can challenge issues of diversity with colleagues or patients or something that comes up. And so there may be a number of things in which you're involved somehow with their skills development. So that's something to, so the first thing to do is to sort of read the criteria, just sort of cast your eyes over the criteria before you start your supervision, so that it begins to sort of sink in a bit. And then as you do your supervision sessions, And by the way, you can also class sessions, you know, you're supervising in class as well, of course, in skills exercises in the mornings, and you're peer supervising colleagues in the afternoons. So you don't need to just use the supervisees that you're working with externally. You can also use other examples from the classroom and from the course to respond to these questions. So these are all questions about your supervision practice. Okay, so if you think of the course as being two-layered, right, as a developing supervisor, on the one hand, it's about the acquisition of skills and models and everything that's going into you to make you a more skilled supervisor. And on the other hand, it's also sort of how you pass things on, how you work with your supervisee to develop them to be able to do something with their patients and their clients. Okay, so think of it as a sort of two-layered thing. And this orange section is dealing with that second layer. You know, all right, so you've got all these skills. Now, what difference is it going to make to your supervisee? And more than that, what difference is it going to make to the people that they work with? You know, and are you able to decipher any of that in your conversations? And you may not be able to sort of decipher that down to the sort of nth degree, but probably through some of the feedback that you get and in the conversations, you're able to see your supervisee's development. And again, you know, you can bring this to your supervision group and you know, perhaps invite some discussion on that. So this workbook criteria then, or I call it the supervision workbook. That's just supervision workbook. We've called it a few different names here, reflective supervision workbook. And sometimes I've referred to it as the supervision criteria workbook. It's the same thing. Okay, so there's only one workbook where you're filling it in. Okay, and this is it. And as I say, so your stage one is the white boxes and the yellow boxes that you'll fill in as well, but the white boxes are the criteria. And then level 2 of this workbook are the orange boxes, and that relates to your supervision practice. So what I suggest is, again, just cast your mind over the thing, read the questions. Don't think you've got to do it all at once. Nothing like that, but perhaps just read it sort of slowly, tortoise-like, and let it sink in for a while. And then, you know, when you come to do some supervision practice and then you're reflecting, you find a quiet place to reflect on the program. Really try and do it, you know, straight after the program, as I say, if you can. And you can always use the training rooms, of course, you know, and stay there because, you know, they'll remain open for a couple of hours after the course finishes, so you can use those training rooms, or you can first thing in the morning, that sort of thing, and just take that time to really think about how it all fits together. And even if you just answer a few questions, you'll be amazed at the progress that you make. So I hope that's helpful. Now let me stop sharing that. I'm back here. And I'm going to stop this recording. So thank you for watching this. If you've watched this before the program, you've done really well. All right, let me try and find the thing to turn this thing off. Stop recording.